Welcome to Keep It Healthy podcast, where we explore how technology is transforming healthcare. I'm your host, Jan Kamiński, co-founder of Momentum. Today, I'm speaking with Koen Lepez, co-founder and CTO of TurnUp, a company that takes care of the no-show problem in healthcare. We'll discuss why no-shows happen and what can be done to fix them. I've seen your journey from ICT to solving no-shows in general, and you've spent over a decade leading different digital transformation and ICT in general. So what was your background and what inspired you to shift into healthcare and tackle the no-show problem with TurnUp?
My background in ICT has always been from a technical perspective. So I was always looking to solve problems for my customers through technology. And at some point, I really felt like I wanted to do a bit more and give something back maybe. And I think healthcare for me stood out because no shows, for example, are not just something financial, but we've noticed that it's also about increasing healthcare capacity in a big part. And for me, after those 10 years of building my last company and selling it, I really wanted to do something to make an impact. And that's basically why I've really chosen this journey that came along a bit by coincidence. My co-founder Nicholas came along with the idea, and then I really saw it as an opportunity to apply technology to a challenge that actually healthcare has been struggling with for decades and is also just a massive problem globally.
A lot of those facilities and clinics are not really tech savvy, right? So like moving with technology to this industry, and did you face resistance, and how was the journey with that?
Yeah, I would say for me, the start in healthcare was especially, I was very surprised about how much or how little technology was really adopted. And I mean the newest features, the stuff that you're used to in even the smallest of businesses in general is something that has not been adopted within healthcare because they're very resistant, I would say, to new technology. And I get that in terms of security and data governance, etc. But I'm also still at this moment surprised at how some things are really far behind. And one of the examples is just some of the software packages that are being used, how I would say legacy they are. So like client server applications, there's little or no real software as a service platforms. And those are things that are difficult because you can also see that the adoption in healthcare in general is, in my regard, a lot slower.
Yeah, I completely agree. But like, I mean, you also mentioned that this problem's been for decades, right? I mean, the no-show crisis, in a sense, or like rather, we can call it an industry challenge, right? So why is it that the no-show problem is so hard to fix? Because obviously they cost healthcare billions and they disrupt care. Yet, I mean, as you said, they're still a major issue. So why do you think healthcare has struggled to solve this, and why it's so hard to fix in general?
First of all, it's and what we've seen, it's not only in healthcare. So there's like a 350 billion challenge in lost revenue in healthcare globally, but 150 in different other businesses. But in healthcare, as technology is not very much easily adopted, it's also a challenge in itself to really get that technology adopted throughout the healthcare. But also, I would say one of the biggest challenges, I mean, it's like when we talk to someone and they're like, "Oh, but isn't someone else solving that already?" And we're always like answering, "Yeah, no, it's not really being done," because people are mostly putting the solution in terms of reminders, getting people to show up, obliging someone, or almost making them or trying to make them show up. But sometimes you just can't, and then you need a solution. So that's where we come in and we replace, the patient with another patient. And I think there's something about that just hasn't been done before. And I know it sounds very simple, but in some way, There hasn't been anyone that really put that into place. Most people focus on either getting someone to show up or make them pay for not showing up or penalizing them in a way, but not really saying, you know what, if you can't show up, just let us know and we'll make sure somebody else replaces you.
And you mentioned other industries. Are there specific industries where no-shows are even worse than healthcare?
I wouldn't say that it's worse in terms of the impact, because healthcare is, that you're if you're not showing up, somebody else is maybe not getting care. While it's, for example, in the hairdresser or beauty industry in general, a lot of people don't show up for getting their hair cut, which can be devastating to some people, but is not as bad, of course, as having an MRI scan because maybe you would have some cancer, something like that. I think the impact is different, but it's still a major problem, because for the caretaker, in terms of economical impact, for somebody who's a hairdresser, it's also a very big problem. 10 out of 20 people don't show up, they'll lose half of their revenue, and that is something that we do see is a very big frustration in all these appointment-based businesses, basically. But also in events, for example, where it's not really a no-show, but let's say I've got a subscription for an opera, and 10% of the people don't show up. You could say, but they paid for their subscription. But on the other hand, they're not consuming anything. They're not, making the economic engine of that facility thrive. So there are different aspects, and it's very diverse. But yeah, I would say that for us, healthcare is the priority, because we really want to make that impact. But we're not saying that in the long term we'll be limited to healthcare. It's just where we feel we can make the greatest impact and the greatest difference at this moment.
I'm sure you have this data, and I was always wondering, what are the causes of the no-show?
It's diverse in terms of the answer. You could say it's just the person himself, because you do see that people that don't show up once or that cancel a bit too late are, I think, 60% more likely to repeat that behavior in the future. So it's basically something within the behavior of the person, but which is mostly also driven by their lives. A very busy life can be an aspect. It can be your age category that has some impact. It could be the time of the month. So in terms of the person not showing up, it's mostly a behavior that these people tend to have, but sometimes there are legitimate reasons as well. So the thing is that for some people, they'll also make a reason more legitimate or use a reason more often than someone else. So I think a lot is behavior, but there's also things like, for example, the weather, which a rainy day can have an impact of 30% on no-show or last-minute cancellations, for example. So that is something that we also take into account. So we take a lot of different factors into our calculation to make sure that we have a realistic estimation of who will or who will not show up for an appointment.
I want to know, how does your solution actually reduce the no-shows? Because I know you're using AI and some predictive analysis to tackle this challenge. And like, what makes your tool and your approach different from the standard reminders, let's say, around DHRs and HISs?
Yeah, I think you've answered it for a bit yourself. So a lot of solutions focus on reminders, getting people to show up and really basing their solution around that. But it's not really a solution, it's a workaround. So somebody's going to pay the price. Either your patient's going to be dissatisfied, your doctor's going to be dissatisfied, and most of all, your front desk or the people following up on this are always going to be dissatisfied. So we focus on a solution for everybody involved. That's basically, I think, to summarize it, we focus on a solution for everybody involved. And how we do that is by what you said. So we predict, based on our AI engine, who's most likely to not show up based on historical data, engagement patterns, external factors like weather, traffic, etc. And then instead of reminding these people, like when we know these people are more likely not to show up, we won't like cancel their appointment or something. We'll just try to persuade them to show up and let them know, let them know that if they don't show up, it's going to take 6 months for the new appointment, or this is the impact that your not attending will have. And so we try to get them to confirm. So they will confirm either that they are coming, or they will confirm a cancellation. Once they confirm a cancellation, we go ahead and replace the patient by another patient that has indicated that they want to come to an appointment as soon as possible. And so we get really high rates in that, like 85%, I think, will convert of the cancellations into another patient showing up. But it's not only about replacing that patient, because even if he's not replaced or she's not replaced, the medical professional and the front desk workers, they'll be satisfied because they will know this person is not showing up. He's not going to be there. So they'll be able to go ahead and schedule something else to do. They'll have a coffee, or they'll be able to do some administrative work. And just that is already very valuable, because otherwise these doctors, these front desk workers, they're looking at each other like, where's this patient? What happened? How come you didn't notice? So there's a lot of frustration, stress that is going on in these practices when, or in these medical facilities, when people just don't show up. And it's I think that's also one of the things that we're trying to tackle, is that stress for those three parties involved.
What surprising data point, that your system has flagged as a strong predictor that someone will just, or like a predictor of a no-show?
Not sure if it's surprising. I think most medical professionals will not find this surprising, but it's what I said before, is like patients that haven't shown up in the past have a 60% bigger likelihood not to show up in the future. And it's very cliche, and it would be something that you're like, yeah, but it has to be more than that. And it is, but it's one of the biggest indicators of somebody not showing up. And that's why a lot of professional or patient management systems, they've included an option to, let or to acknowledge that somebody has not shown up or canceled late, so as that they would know to work around this. And that's one of the most surprising facts, is that these patient management systems have adopted to make it insightful, but still they haven't found a solution. So they're like, you know what, we'll let you know, so you can schedule two people at the same time, and maybe you'll be lucky and they'll both show up, but then your planning is completely messed up. So that was one of maybe the biggest surprise for me, that these PMS systems, they will acknowledge it's a problem, and they know, and they'll make it insightful, but they won't provide a solution. And so that's where we want to come in and just help across all these different PMS systems, help them solve it for their patients, basically.
Okay, but can you be like 100% certain? That might be a dumb question, but I mean, can AI predict a no-show with near certainty?
No, we can never be 100% certain. So we can predict it as good as possible. And then we'll have, I think we're about at 80% almost of accuracy. So in the practice, I think the most difficult one is where we really have no clue that one person is not going to show up, and we mark him or her as they're going to show up. So then we don't do the extra follow-up, and then maybe they will be missing their appointment. In most of the cases, in 80% of the cases, we do know this person is very likely not to show up, or this person is not going to show up, and then we follow them up more closely and make sure that somebody will show up. But yeah, I think it's 80 or 85% accuracy at the moment, and the no-show prediction model. So we're getting there, and it's getting better every day. And I've seen our team doing a lot of great work with some AI technology.
What's been the hardest part of scaling a healthcare product or like TurnUp? So, obviously scaling health tech is just notoriously tough. So what has been the biggest roadblock in growing your product so far?
Yeah, I think it comes back a bit to what I said before, is that the adoption rate in general is very slow. So people have very long decision cycles. For example, the first time we tried to get into a major hospital, I think it took about a year to get to the actual point of starting to test it, the product. So whereas we've seen more rapid return on investment is, for example, dental service organizations or DSOs, when we could show that they are losing a lot of money and that we can help them restore that, they will go a lot faster in the implementation than, for example, a hospital or
But
a
but
legacy.
Isn't that because they are A, private, B, smaller, you know?
Yeah, maybe the private public piece would fit into that as well. But I've seen in hospitals in general for now, we've seen it's a bit more resistant and it takes a bit more time, even though you can show the numbers. And I've also seen that there are different perspectives into what they want to see solved. So your value proposition is different. And some they care more about, getting the revenue back, or not losing that much money to these symptoms or this no-show. And other hospitals, for example, there's a lot more sympathy for, we need to help our front desk workers experience less stress. I had an example for, I think just last week we did a proof of concept with a big hospital where 4 out of the 5 front desk workers were ill in that week. Very coincidental. We didn't have anything to do with it, but we were able to manage and resolve 93% of all cancellations, fill them back in. So that's an amazing result. And where we thought with these people being sick, it's going to be a very tough for us to do that. So we do know that it takes away a lot of stress for the people at the front desk, and it's not to be underestimated. I think if you see how much these unscheduled, unannounced events impact their work-life balance, or just their work in general. And I've seen that in hospitals, what they think is very valuable is to be able to have a more predictable schedule for their front desk workers. Yeah. So, but maybe to answer your question, I think selling in healthcare maybe is one of the biggest challenges, like really getting across that, building that confidence, and getting to know people.
So what was your approach? I mean, selling into healthcare, like what's worked and what's been the most challenging? Like contact or procurement? Like what was it?
For example, DSOs, dental service organizations in general, we had a lot of trouble reaching people because they're very busy by phone. It's very difficult to reach them. All the dentists or the decision makers are generally not available. So what we did is we really went and hustled our way into the practices, introducing ourselves as TurnUp and wanting to solve no-show, giving them just a little leaflet to keep track of how many people are not showing up. And then we would call back a couple of weeks later, gather the results, and show those to the actual managers of the group, for example. And they would generally be very surprised by the numbers, especially when we told them, okay, look, this is what is going on in your practices, and we can help you solve it. And so that got the conversation going. I think now there's a lot of word of mouth. People are really talking about, the solution and our platform, but I wouldn't say there's a one approach that fits all. In hospitals in general, it's more like knowing people, trying to get a conversation going, and just showing them what you can do, and then leave it to them to reach back out. I think it's a vertical where it doesn't work to push. I think you need people to reach out and to be interested, to be genuinely interested in your platform, for example.
Are providers hesitant about AI-driven solutions, or you need to convince them, or they're for it?
I think it's important they do want to try to understand how it works, what it does for them, and what is going to happen with the data. But we work mostly with aggregated data, anonymous data, so we don't just go and push all the data to our platform. It's very much controlled, and that's something we see, is that the DPOs, the data protection officers, they're really thorough about what they will send to us and what they won't send to us. And it's also something that we want to keep in check for ourselves. So we don't want all the data to be using only 10% of it. So we just ask for the absolute necessary data, and we make sure that it's aggregated or that it's hashed, so it gets into our database, and there is no way of just starting to use it for something different than what it's what the purpose is, which is basically helping the patient get to an appointment sooner, making sure that people show up or turn up. And then I think that's one of the most important things, and to show them also that it's really helping us to make better decisions, helping them to make better decisions, and not taking away control.
some decision makers like DPOs from the provider side, do they truly trust AI yet, or you need to fight the skepticism, or I mean, as a challenge? You know what I mean?
I would say that they're as reluctant maybe as we all are. I think I love AI and I love to use ChatGPT, but sometimes I find myself thinking, should I put this in there and what's going to happen with it afterwards? So I think everybody's still a bit reluctant, and depending on which platform or AI engine you're using, it is something to be careful with as well, I think so. But in the market in general, just like in other markets, I think there's a lot of hesitance still towards AI and a lot of skepticism, like, do I want to do this? But I think it's important to to be very open, transparent about what you're doing with it, what your AI engine is doing, how you use the data. And I think then it's not really a problem, because we're not like an open platform, or selling our data or doing anything like that.
How do you see the product scaling internationally? Because there are probably regulatory barriers in each country, especially in Europe and in the US. They're completely different. So, what's your plan, or you rather focus on one market for now?
Um, we're very present in Belgium at the moment. Also exploring and converting some customers in the Netherlands, and we have some first dental service organizations, for example, in the UK, where the market is very interesting in terms of their software implementations, because in general they are more open and already using more software as a service platforms with open APIs or easier integration, whereas in Belgium and the Netherlands, for example, there's a lot more client server software, which makes things sometimes a bit of a challenge to be able to automate, be able to read and write towards these patient management systems, because we do need an integration, we do need a connection towards these databases to be able to uh, provide the most value. In terms of internationalization, we are really looking with big interest to the UK market, NHS, what we can help them solve there as well, because there's a lot of patients that don't get to an appointment in time. They have a lot of long waiting times. So I wouldn't say we're going to be only in the Belgian market, but today our biggest focus is in the dental industry. While as we are exploring some hospitals in Belgium, we will probably limit that to Belgium for now in terms of the hospitals. But internationally, we are very much looking towards expanding on the dental market. And in that aspect, there's a very big opportunity in the US. But I think we need to first look at the UK more as a first start into that English speaking market, perhaps.
Do you have how do you tackle this regulatory issue? Do you have like compliance officer? Like, how do you, let's say, analyze each market's perspective? From like whether, hey, you just mentioned UK API is open. I mean, completely
Yeah.
different from the interoperability perspective, right? So like, how do you do it?
So when I'm talking about the dental industry and the focus that we have on that industry for now, is largely driven because of the fact that they have a lot of consolidation in that market, but also because dental industry in general, there's a lot of waiting lists, a lot of people that cannot get to an appointment fast enough. So those waiting lists are really a tool for us to be able to manage them efficiently, put them to use to replace the patients at these dentists, but also because there are a lot of groups being bought and managed by private equity, means that they consolidate, they buy centrally, very centrally. So when we need to persuade someone or really get in a foot in the door, it's enough to show the results of one of the practices or some of the practices, and then take it towards the entire group, and they decide very fast and efficient. So I think that's one of the reasons why we also look at how consolidated is the market. For example, in France, it's a bit more fragmented than in the UK. So we'll probably first move into the UK for that reason, but also because they are using the software as a service platforms more with the open APIs and the compatibility. So those are the things that we're looking at a bit to move forward.
TurnUp is growing. You've led companies before as well. So what's a one piece of advice you'd give to founders trying to scale in health tech?
I would say try to build for innovation, as you would always do, but also for adoption. So make sure that your product is not just something that you think is great, but that people are going to also use, and you will be able to get it into a next phase, because that's always been a challenge. At first, we really built what customers at that moment didn't only need, but also wanted. Because sometimes you think, okay, they need this, but if they don't want it, they'll
Yeah.
still not use it, even though they need it. So it's if that makes sense. I don't know if it makes
Yeah,
sense, but
no,
it's
sure,
basically
sure.
what I've seen is that maybe in general, throughout businesses in general, not just healthcare, is also validate your assumptions is maybe one of the most practical things. But in every business, don't just make an assumption and assume, okay, I know this, I know that, and probably this is going to be the result. Try it out. I think one of our core values is think big, start small. And I think that's something really to consider, is to, if you think this is going to work, try it out, validate it, and then move forward with it.
If you were starting over today with this product, what would you do differently from day one?
That's something maybe difficult in healthcare to to say, but I would probably try to get our product adopted faster, get people to use it, and really learn from the feedback. Maybe make it for free or make it even cheaper than we did at first, just to be able to launch it. Because I think it's,
Interesting. Hmm.
in terms of perfection, especially when you have a technical background like I do, you always want things perfect before you get them out to people. And I'm not saying I regret it, but it just would have helped us understand better the needs of the customer, and validate it, as I said, validate those assumptions before building something to perfection, and then just seeing that maybe it should have been a bit different. So I think having a good group of people testing your product, maybe a pre-release group or something like that, I would say would be very, very interesting to have.
Yeah, interesting. So feedback over, yeah, adoption over perfection. I like it. So yeah, what does the future look like for TurnUp? What innovations or expansions rather are on the horizon?
I mean, it's very interesting because our marketing approach is very interesting and very likable. People, when we're at a trade fair, for example, and people see, okay, no show, last minute cancellation, we solve it for you. That's something very attractive, and people are always very interested. But we don't want to be a one-trick pony, in the sense that we're not going to only do this. So, for example, a lot of PMS systems work very broad. So they will do a lot of things for their customers, which is a good thing, because that's what they need. They need some efficient place to schedule, to put pictures, a medical file, all these things together. But we really want to dive deep into scheduling. So perfecting that, being able to not only predict, but schedule efficiently, making sure that we can, for example, pre-schedule appointments for some patients by having more data available, being able to know, okay, Jan is probably going to need an appointment at this specialist at that moment. And even though you don't know, we'll just suggest it to you, and it's your choice to do it or not to do it, if you choose to be notified for these things. I think in Japan, for example, I believe that people are obliged to go to the doctor 2 times, the general practitioner, 2 times per year, which just by itself already increases the lifetime expectation of Japanese people by a very high factor. So these type of things you can do just organically, or schedule an appointment, or you can really use data that is already known, to be able to help people, just live longer, or get them the help they need in time, and maybe just in time scheduling as well. One of the things that is asked a lot also is the doctor no-show functionality, we call it. So whereas if a doctor is sick, or has the flu for a week, that means that 100, 120 appointments in that week are going to need to be rescheduled. So instead of doing that manually and calling people, we want to automate that and make sure that if somebody is sick, that we can just, not put that load on the front desk, on these people that need to do the scheduling, and we can just automate this and make sure that every patient gets an appointment as fast as possible, but also that the doctor doesn't have to be worried about, okay, I'm sick and now I'm not going to be able to service my patients, that they can, be at peace and not have that stress of, yeah, we're going to have to reschedule 120 patients, because a lot of doctors just go to work sick. That's what I hear a lot of people. We don't have sick doctors. I'm like, how is that? Well, they'll just come and work even though they're sick, so it's probably not the advice they would give to their patients. So, yeah.
Yeah. So you would expand beyond no-shows into, let's say, patient engagement tools or something around it.
Yeah. So I would say AI-driven patient engagement, cancellation management, smart scheduling, and really, being able to reduce the effort that the front desk workers have, making sure that they can focus on things that bring them more energy, but also making healthcare scheduling more efficient, because there are a lot of challenges now that we see. It's just, that a lot of manual work that can be taken away, automated, but also, for example, general practitioners that work alone, we want to be able to help them schedule their patients more efficiently. They don't have the time to be thinking, oh, Koen is turning 40 next year, he might have to come in for this type of consultancy. And so it'll help, or we want to help them better understand their patients, give them insights into when they need to schedule what, to make sure that everyone just lives a longer and healthier life in general. So that's the big, hairy, audacious goal, maybe, is to get there, to really provide value for patients, to have an impact on people's lives where it matters the most.
I like it. How can our listeners learn more about or connect with TurnUp?
I would say visit our website, which is turnup.world. It's just our URL that we've changed to turnup.world. And I would say connect on LinkedIn, follow our pages, and just, schedule a meeting and let's connect.
Yeah, Koen, thank you very much for joining us today.
Thank you so much, Jan, for having us, and I hope we'll see each other soon.
Thanks for tuning in to Keep It Healthy, where we explore how technology is transforming healthcare. If you're building in health tech, visit our website to download our MVP development playbook. The link is in the show notes. Don't forget to subscribe for more conversations with the people shaping the futures of care. I'm Jan Kamiński. See you next time.